Cellular adaptation. Adaptations are reversible changes in the number, size, phenotype, metabolic activity or functions of cell in response to changes in their environment. Cellular adaptations দু রকমের হয়, একটা physiologic adaptations, একটা pathologic adaptations. Physiologic adaptations are response to cell to normal stimulation by hormones or endogenous chemical mediators. Pathologic adaptations are response to stress that allow cell to modulate their structure and function and thus escape injury. Now, normal cell যখন স্ট্রেস হয় অ্যাডাপ্টেশন, তো অ্যাডাপ্টেশন after adaptation cell injury. This cell injury may be reversible, may be irreversible. If the cell injury is reversible, then it will become normal cell again. But if it is irreversible cell injury, then cell death will occur. Cell death, two types, necrosis and apoptosis. Now, these are various types of cellular adaptations. One is hypertrophy, atrophy, hyperplasia, dysplasia, metaplasia. These are the plasia: hyperplasia, hypoplasia, metaplasia, dysplasia, anaplasia. These are different types of trophy: hypertrophy, dystrophy, hypertrophy. Hypertrophy. Hypertrophy is an increase in the size of parenchymal cell. Here, single cell, সেটাই size বাড়ছে. This is called hypertrophy. Without any changes in the number of cell. Cell number বাড়ে না, একটাই cell, single cell, size বাড়ে. Increase in the size. Now, cause, it may be physiologic, may be pathologic. In either case, it is caused by increased functional demand or by hormonal stimulation. Hypertrophy without accompanying hyperplasia affect mainly muscle. Physiologic hypertrophy, enlarged size of uterus in pregnancy is an example of physiologic hypertrophy, as well as hyperplasia. Pathologic hypertrophy, hypertrophy of cardiac muscle, may occur in a number of cardiovascular disease. Systemic hypertension, aortic valve disease, mitral insufficiency, hypertrophy of smooth muscle, cardiac achalasia, pylori stenosis, intestinal stricture, muscular artery in hypertension. Now, hypertrophy of skeletal muscle and compensatory hypertrophy may occur in an organ when contralateral organ is removed. Following nephrectomy on one side in a young patient, there is compensatory hypertrophy as well as hyperplasia of the nephron of the other kidney. কারণ একটা সাইডের কিডনি কেটে ভাগ দেওয়া হয়েছে, সেই কারণে। Cardiac hypertrophy, you can see muscle become hypertrophic. আর ওভারঅল ওয়েটটাও ইনক্রিজ হয়ে গেছে হার্টের। নর্মাল হার্ট এরকম হয় না, অ্যাথোথিক মাসল এগুলো সব হাইপারট্রফিক। Now, morphologic features. The affected organ is enlarged and heavy. For example, a hypertrophic heart of a patient with systemic hypertension may weigh 700 to 800 grams. A normal heart has 350 grams. There is enlargement of muscle fiber as well as of nuclei, and at ultrastructure level, increased synthesis of DNA and RNA. So the main reason behind this is increased synthesis of DNA and RNA. Increased protein synthesis and increased number of organelles such as mitochondria, endoplasmic reticulum, and myofibrils. Now, hyperplasia. Hyperplasia is the increase in the number of parenchymal cells. Here, cell number will increase. Quite often, both hyperplasia and hypertrophy occur together. Hyperplasia occurs due to increased recruitment of cell from G0 phase of the cell cycle to undergo mitosis when stimulated. G0 is the resting phase. Neoplasia differs from hyperplasia in having hyperplastic growth with loss of growth regulatory mechanism, while hyperplasia persists so long as stimulus is present. But neoplasia is persist যদি স্ট্রেস নাও থাকে তাহলেও নিওপ্লাসিয়া সেল উইল ইনক্রিজ। স্টিমুলাস না থাকলেও নিওপ্লাসিয়া আর ক্যান্সারে সেল ইনক্রিজ হবে, বাট হাইপারপ্লেসিয়া সেরকম না। হাইপারপ্লেসিয়া persists so long as stimulus is present. Now physiologic hyperplasia. Hormonal hyperplasia. This is the most common. Hyperplasia occurring under the influence of hormonal stimulation. Hyperplasia of female breast at puberty during pregnancy and lactation. Hyperplasia of pregnant uterus. Proliferative activity of normal endometrium after a normal menstrual cycle. Prostatic hyperplasia in old age. Now compensatory hyperplasia. That is hyperplasia occurring following removal of part of an organ or in the contralateral organ in paired organ. Regeneration of the liver following partial hepatectomy. Regeneration of epidermis after skin abrasion. Following nephrectomy on one side, there is hyperplasia of nephron of the other kidney. Now pathologic hyperplasia. Endometrial hyperplasia following estrogen excess. In wound healing, there is formation of granulation tissue due to proliferation of fibroblasts and endothelial cells. Formation of skin wart from hyperplasia of epidermis due to human papillomavirus. Morphologic features, there is enlargement of the affected organ or tissue and increase in the number of cells. This is due to increased rate of DNA synthesis and hence increased mitosis of the cell. Now this is the normal endometrium and this is the endometrial hyperplasia. Here you can see the endometrium, it is normal. Wall is normal, but here wall is thickened. Wall become thickened. And hyperplasia of prostate gland. Now hypoplasia. Hypoplasia refers to incomplete development or decreased size of an organ not reaching the normal adult size with decreased number of cells. Example, microplasia. Now atrophy. Reduction of the number and size of parenchymal cell of an organ or its parts which was once normal is called atrophy. Atrophy মানে হলো সাইজে ছোট হয়ে যাচ্ছে, decrease in the size. Shrinkage in the size of the cell by the loss of cell substance results from decreased protein synthesis and increased protein degradation in cell is accompanied in many situations by increased autophagy with resulting increase in autophagic vacuoles. Cause physiologic atrophy, atrophy of lymphoid tissue with age, atrophy of thymus in adult life, atrophy of gonads after menopause, atrophy of brain with aging, osteoporosis with reduction in size of bony trabeculae due to aging. Now pathologic atrophy. Starvation atrophy. In starvation, there is first depletion of carbohydrate and fat store followed by protein catabolism. There is general weakness, emaciation, and anemia referred to as cachexia seen in cancer and severely ill patient. Then ischemic atrophy. Gradual diminution of blood supply due to atherosclerosis may result in shrinkage of the affected organ. Example, small atrophic kidney in atherosclerosis of renal artery. Atrophy of brain in cerebral atherosclerosis. কেন হচ্ছে? কারণ ব্লাড সাপ্লাইটা ডিক্রিজ হয়ে গেছে, ডিমিনিউট হয়ে গেছে। That's why ischemic atrophy is occurring. Then diffuse atrophy. Prolonged diminished functional activity is associated with diffuse atrophy of the organ, like wasting of muscle of limb, immobilizing cask, atrophy of pancreas, and obstruction of pancreatic duct. Then neuropathic atrophy. Interaction in nerve supply leads to wasting of muscle like poliomyelitis and motor neuron disease, MND. Endocrine atrophy. Loss of endocrine regulatory mechanism results in reduced metabolic activity of tissue and hence atrophy. Hyperpituitarism may lead to atrophy of thyroid adrenal neurons. Then pressure atrophy. Prolonged pressure from benign tumor or cyst or aneurysm may cause compression and atrophy of the tissue. Example, erosion of the spine by tumor in nerve root, erosion of the skull by meningioma arising from pia arachnoid. Idiopathic atrophy, there are some examples of atrophy where no obvious cause is present, like myopathy. Now morphologic features. The organs become small, often shrunken, the cell becomes smaller in size, but cells are not dead cells. Shrinkage in cell size due to reduction in cell organelles, chiefly mitochondria, myofilaments, and endoplasmic reticulum. There is often increase in the number of autophagic vacuoles containing cell debris. The autophagic vacuoles may persist to form residual bodies in the cell cytoplasm, lipofuscin pigment granules in brown atrophy. Now this is the atrophic brain. It is the normal brain structure in young adult, and this is the atrophy of brain in an older person. These are atherosclerotic vessels, these vessels. And atrophy in osteoporosis. Now metaplasia. Metaplasia is defined as reversible change of one type of epithelium or mesenchymal adult cell to another type of adult epithelial or mesenchymal cells. It is of two types, epithelial and mesenchymal. Epithelial metaplasia is more common type. The metaplastic change may be patchy or diffuse and usually resulting in replacement by stronger but less well-specialized epithelium. It is of two types, squamous and columnar. Squamous metaplasia, this is more common. Various types of specialized epithelium are capable of undergoing squamous metaplastic changes due to chronic irritation that may be mechanical, chemical, or infective in origin. Some common example in bronchus, normally lined by pseudostratified columnar ciliated epithelium in chronic smoker. In uterine endocervix, normally lined by simple columnar epithelium. In prolapse of the uterus in old age. In gallbladder, in chronic cholecystitis with cholonucleosis. Normally gallbladder lined by simple columnar epithelium. যে এপিথেলিয়ামটা পরে হচ্ছে সেই এপিথেলিয়ামের নামে মেটাপ্লাসিয়াটা হবে, চেঞ্জ হয়ে যেটা হচ্ছে সেই মেটাপ্লাসিয়াটা হবে। স্কোয়ামাস মেটাপ্লাসিয়া মানে হচ্ছে চেঞ্জ হয়ে কলামনার থেকে চেঞ্জ হয়ে স্কোয়ামাসে হচ্ছে, তো ওটা স্কোয়ামাস মেটাপ্লাসিয়া। পরে যেটা হচ্ছে সেইটার নামে হবে। In prostate, in chronic prostatitis and estrogen therapy. Now columnar metaplasia, intestinal metaplasia in healed chronic gastric ulcer. Columnar metaplasia in Barrett's esophagus, in which there is change of normal squamous epithelium to columnar epithelium. Normally squamous epithelium থাকছে ইসোফেগাসের নিচে, কিন্তু ব্যারেক্স ইসোফেগাসে চেঞ্জ হয়ে কলামনার এপিথেলিয়াম হচ্ছে, তাহলে এটা কলামনার মেটাপ্লাসিয়া। Conversion of pseudostratified ciliated columnar epithelium in chronic bronchitis and bronchiectasis to columnar type. Now mesenchymal metaplasia. Less often there is transformation of one adult type of mesenchymal tissue to another. Osseous metaplasia is formation of bone in fibrous tissue, cartilage, and myxoid tissue. Example of osseous metaplasia in arterial wall in old age, like Montbard medial calcium sclerosis, in soft tissue in myositis ossificans, in cartilage of larynx, and bronchi in elderly people. Now, cartilaginous metaplasia. In healing of fracture, cartilaginous metaplasia may occur when there is undue morbidity, undue mobility. Now, this is the diagram showing normal endothelium, endocervical epithelium. It is squamous metaplasia, then dysplasia, then carcinoma in situ. So, what is carcinoma in situ? A full thickness dysplasia. Dysplasia is disordered cell growth. তো প্রথমে নর্মাল এন্ডোসার্ভাইকাল এপিথেলিয়াম থেকে স্কোয়ামাস মেটাপ্লাসিয়া হচ্ছে, তারপরে ডিসপ্লাসিয়া, তারপরে কার্সিনোমা ইন সিটু। This is the squamous epithelium. These are squamous cells. These are squamous cells. And these are columnar epithelium. These are squamous. These are squamous cells. These are columnar cells. Now dysplasia. Dysplasia means disordered cellular development or disordered cell growth. Often preceded or accompanied with metaplasia and hyperplasia. It is therefore also referred to as atypical hyperplasia. Atypical hyperplasia তখনই বলা হয় যখন dysplasia থাকে ওখানে, তখন ওটা atypical hyperplasia হয়ে যায়। Dysplasia occur most often in epithelial cells. Epithelial dysplasia is characterized by cellular proliferation and cytologic changes, increased number of layers of epithelial cells, disorderly arrangement of cell from basal layer to the surface layer, loss of basal polarity, that is nuclei lying away from the basement membrane, cellular and nuclear pleomorphism, increased nucleocytoplasmic ratio, nuclear hyperchromatism. These are features of dysplasia. The two most common examples of dysplasia are uterine cervix and respiratory tract. Dysplastic changes often occur due to chronic irritation or prolonged inflammation. On removal of the inciting stimulus, the change may disappear. In a proportion of cases, however, dysplasia may progress into carcinoma in situ or invasive cancer. So dysplasia থেকে ক্যান্সার হতে পারে, যতক্ষণ অব্দি বেসমেন্ট মেমব্রেনের মধ্যে আছে ব্রিজ করেনি ততক্ষণ অব্দি ওটা ডিসপ্লাসিয়া বা কার্সিনোমা ইন সিটু। যখনই বেসমেন্ট মেমব্রেনটা ব্রিজ করে গেল তখন আর কার্সিনোমা ইন সিটু থাকলো না, তখন ক্যান্সারই হয়ে গেল, কার্সিনোমাই হয়ে গেল। Uterine cervical dysplasia, high grade lesion. So you can see here, these are colocytes, these are mitosis, and these are disorderly layer of squamous epithelium. These all are squamous epithelium. But it is cervical dysplasia. কারণ বেসমেন্ট মেমব্রেনটা ইনট্যাক্ট আছে, এটা এখনো ব্রিজ করেনি, তার জন্য এটা হলো বেসমেন্ট মেমব্রেন। Now cellular aging. Cellular aging is the result of a progressive decline in cellular function and viability caused by genetic abnormalities and the accumulation of cellular and molecular damage due to effect of exposure to exogenous influences. Studies in modern systems have clearly established that aging is influenced by a limited number of genes and genetic anomalies underlying syndrome, resembling premature aging in humans as well. Such findings suggest that aging is associated with definable mechanistic alteration. There are several mechanisms involving cellular aging. First is DNA damage. A variety of exogenous like physical, chemical, biological agents and endogenous factors such as reactive oxygen species or ROS are threatening the integrity of nuclear and mitochondrial DNA. Although most DNA damage is repaired by DNA repair agents, some parts can accumulate as cell age. Next generation DNA separation studies have shown that the average hematopoietic stem cell suffers 40 new mutations per year. And it is likely that this accumulation damage explains why, like most cancer, most common hematologic malignancy, disease of the aged. Hematopoietic stem cell থেকেই আমাদের সমস্ত সেলগুলো তৈরি হয়। তো হেমাটোপয়েটিক স্টেম সেল এভরি ইয়ার 14 নিউ 14টা করে নিউ মিউটেশন অ্যাপিয়ার করে। তো তাই জন্য উইথ অ্যাডভান্সিং এজ হেমাটোলজিক্যাল ম্যালিগনেন্সিগুলো অ্যাপিয়ার করে। Patients with Warner syndrome show premature aging and defective gene product is a DNA heritage. Second is cellular senescence. All normal cells have a limited capacity for replication, and after a fixed number of division, cells become arrested in a terminally non-dividing state, known as replicative senescence. Aging is associated with progressive replicative senescence of cells. Cells from children have the capacity to undergo more rounds of replication than do cells from older people. Two mechanisms involved. One is telomere attrition. One mechanism of replicative senescence involves progressive shortening of telomeres, which ultimately result in cell cycle arrest. Telomeres are short, repeated sequence of DNA present at the ends of linear chromosomes. Telomerase is a specialized RNA protein complex that uses its own RNA as a template for adding nucleotides to the end of chromosome. Telomerase is expressed in germ cell and it is present at low levels in stem cell, but it is totally absent in most of the somatic tissue. So this is the main reason why telomere attrition is occurring, because telomerase enzyme is absent in somatic tissue. Therefore, as most somatic cell age, their telomeres become shorter and they exit the cycle. Telomeres become shorter, and when they become shorter, they exit from the cell cycle. ওরা next cycle আর participate করতে পারছে না। আর যেহেতু মোস্ট অফ দ্য সোমাটিক সেলে টেলোমারেজ এনজাইমটা থাকে না, তো তাই জন্য ওই যে সিকোয়েন্সটা ওইটার টেলোমিয়ারের ইয়েকে লাগছেও না আর। So resulting in an inability to generate new cells to replace damaged ones. Then activation of tumor suppressor genes. In addition to telomere attrition, activation of certain tumor suppressor genes, particularly those encoded by the CD8QA locus, also seem to be involved in controlling replicative senescence. This is the cell cycle. G0, G1, S, G2, M. There are three types of cell in our body. One is Laval cell, stable cell, permanent cell. Laval cell is always dividing. Constantly it is dividing. Laval cell. Stable cell, where যখন দরকার তখনও ডিভাইড হচ্ছে। আর পার্মানেন্ট সেল কখনোই ডিভাইড হয় না, কখনোই, নেভার, ইট নেভার ডিভাইড। Permanent cellular example, neuron, and another is cardiac muscle cells. Now, defective protein homeostasis. Protein homeostasis involves two mechanisms: maintenance of proteins in their correctly folded conformation and degradation of misfolded, damaged, or unneeded proteins by the autophagy lysosome system and ubiquitin proteasome system. There is evidence that both normal folding and degradation of misfolded protein are impaired with aging. যত বয়স বাড়ে, যত এজিং হয়, তত মিসফোল্ডেড প্রোটিনগুলো অ্যাকুমুলেট হতে থাকে। Of interest, administration of rapamycin, which inhibits the mTOR molecular target of rapamycin pathway increase the lifespan of middle-aged mice. Rapamycin has multiple effects including promotion of autophagy. Abnormal protein homeostasis can have many effects on cells, survival, replication, and functions. In addition, it may lead to accumulation of misfolded protein, which can trigger apoptosis. Rapamycin is a drug which causes immunosuppression. Immunosuppressant drug, rapamycin. Now, another mechanism is of cellular aging is dysregulated nutrient sensing. Paradoxical though it may seem, eating less increase longevity. कम खेले बेशी दिन बच जाए. Eating less increase longevity. Caloric restriction increase lifespan in all eukaryotic species in which it has been tested, with encouraging result. Because of these observations, there has been much interest in deciphering the role of nutrient sensing in aging. Although incompletely understood, there are two major neurohormonal circuits that regulate metabolism. One is insulin and insulin-like growth factor 1 signaling pathway, IGF-1 pathway. IGF-1 is produced in many cell types in response to growth hormone secretion by the pituitary gland. IGF-1, as indicated by its name, mimics intracellular signaling by insulin and thereby informs cell of the availability of glucose, promoting an anabolic state as well as cell growth and replication. Another is sirtuins. Sirtuins are a family of energy-dependent protein deacetylase. Sirtuins are thought to promote the expression of several genes whose product increase longevity. These include proteins that inhibit metabolic activity, reduce apoptosis, stimulate protein folding, counteract harmful effect of oxygen-free radical. Sirtuin also increase insulin sensitivity and glucose metabolism and may be targeted for the treatment of diabetes. Now the summary. The cellular aging results from a combination of accumulating cellular damage, reduced capacity to divide. There are several mechanisms. One is accumulation of DNA damage, defective DNA repair mechanism. Conversely, caloric restriction may activate DNA repair and slow aging in model organisms. Then replicative senescence, reduced capacity of cells to divide secondary to progressive shortening of chromosomal ends. Then defective protein homeostasis, resulting from impaired chaperone and proteasome function. Then nutrient sensing system, caloric restriction, increase longevity. Mediators may be reduced IGF-1 signaling and increase sirtuins.